request of Councilmember McKeown that, consistent with its earlier endorsement of then Senator Sheila Kuehl's universal single-payer health bill, the City Council endorse SB 810 and HR 676. You have 3 requests to speak.
Mr. McKeown.
Yes, tomorrow, in less than 12 hours, actually, the state bill goes to its first committee meeting, so I'm glad we got to this tonight. It was 4 years ago that this council unanimously supported the idea of universal single-payer health care when the original bill was brought by Sheila Kuehl, who was then our state senator. Since that time, that bill, or a bill like it, was passed in both houses of the state legislature, but vetoed by the governor. So that bill is coming back in the state level. There's also a national bill for universal single-payer health care, and let's hear from the public on that.
Thanks. We have 3 requests to speak. I'll call all 3 names. Geri Jenkins, Dr. Joe Olson, and Dr. Ma Hendrickson. Ms. Jenkins.
My name is Geri Jenkins. I am a registered nurse, and I am the co-president of the California Nurses National Nurses Organizing Committee. And I would like to encourage you to support this endorsement. We're 4 years down the road. We're 4 years more in trouble with our health care. Single payer is the most equitable way to create a uniform standard of care for everyone. It's also the most cost-effective way to provide care, and so I highly encourage you to endorse both these, Conyers and the Leno bill. Thank you.
Thank you. Dr. Olson?
I can't believe I'm still standing. My name is Dr. Johanna Olson. Thank you for hearing me today. I'm a pediatrician at Children's Hospital Los Angeles and an assistant professor at USC. I'm also a full-time clinician at Children's Hospital and the Southern California co-chair of the Progressive Caucus and a member of Progressive Democrats of America. I have just 4 little bullet points here. The first one is, and the one that I know most intimately, is the system is broken. I had a young person come in just a few weeks ago who was disappointed not to have HIV because she knew her services would be better if she were infected with the virus. That's a really sad state of affairs about our system, and I could tell you anecdotes all night long, but I'm sure you really don't want to stay for that. I also want to let you know that there's only a couple of things that you really need to know about the single-payer health care plan or the system, the idea that's put forth in both the state bills in the past, the one that's coming up, and in the national bill by Conyers. One is that it takes the profit system out of healthcare. We're the only industrialized nation that doesn't provide healthcare for all of our people. It's barbaric not to, and it's also barbaric that somebody else gets closer to owning a yacht if your kid has a brain tumor. So think about that when you're thinking about this endorsement. It's also important to understand that the risk pool gets expanded when everybody's in it, which means the cost goes down and there's cost savings for everyone. Frankly, you should do it right here in your own city to start with. National health insurance is really the inevitable end of this story. We need to get to it quicker. It's the people's, this is the issue of the people, and it's groups like you that can bring this forward and make it happen. So I would really appreciate it if you considered supporting this idea by the council member. Thank you.
Thank you. Dr. Hendrickson?
Good morning. My name is Matt Hendrickson. I'm an emergency physician and a resident of Santa Monica for 12 years. And I'm also a founding member of the Southern California chapter of Physicians for a National Health Program. We had our inaugural meeting last week, 50 physicians in my backyard on 22nd Street, listening to Sheila Kuehl speak on the merits of SB 810 and HR 676. Americans spend an outrageous amount on health care. We spend twice as much as most developed nations on health care. We're the most expensive in the world, and yet we have 47 million Americans that are uninsured. 18,000 Americans die every year for lack of health insurance. A citizen of Santa Monica spoke earlier about the power that you guys have in creating these parks for Santa Monica citizens. You also have the power to endorse something that will allow all these citizens of Santa Monica to be guaranteed health care for their entire lives. It's a very powerful position you're in, and I strongly endorse Councilmember McKeown's action on this matter. Thank you.
Thank you. Matters before the council, Mr. McKeown.
Move it.
Well, it won't be my action, it'll be this council's action, I hope. This is the issue of the moment, and the timeliness is extreme. As I said, the state bill goes to its first committee meeting tomorrow. Next Wednesday here in Santa Monica, there'll be a Healthcare Not Warfare Forum with Tom Hayden, Mimi Kennedy, Norman Solomon, and others. That's at St. Anne's at 7. Sheila Kuehl was mentioned a couple of times, and she could not be here tonight. She is in Sacramento, but she's here in spirit because it was she who really championed this in the state of California and got universal single-payer health care going. So I will move that we do endorse both the state and national bills.
Okay, Mr. O'Connor had moved it. I'll take that as a second, and by McKeown, and you call the roll, Ms. Stewart.
Councilmember Bloom? Excuse me, Mayor Pro Tem O'Connor?
Yes.
Councilmember Davis?
Here? Yes. I just wanted to remind you I was here this time. Yes. I'm still here.
Councilmember Sharver is not present. Councilmember McKeown?
Yes.
Mayor Gensler?
Yes, that passed by all the members present.